So when it comes to our nutrition tests, there are several different words that are kind of thrown out there. We hear words like intracellular, extracellular. We hear words like functional versus direct assessment. Can you guys touch upon like what are those terms mean in a laboratory context, and what's the difference, and what does Genova add to nutrition testing?
Sure.
Yeah, that's a great question, and it's pretty common. So most of our nutritional tests are a combination of both direct and what we call functional. And when we think about a direct measurement of a nutrient, it's exactly what you'd expect even in the conventional world, where you go to a conventional lab, they take your serum, they're looking at a level of a specific nutrient, which is great. However, there are some limitations to that, though in some instances, it's the preferred way to do it, like something like vitamin D, like we measure directly, vitamin D, we measure it directly. However, if you can consider that, something like potassium, right? Genova measures it directly in red blood cell, for example. Whereas if you go to conventional lab, their direct measurement in the serum is remarkably different because it's very tightly controlled based on your renal function and your acid base status. And so what Genova's done is we've looked to see where is the best matrix for which to assess each nutrient. And that's kind of how we've built our profiles around nutrition. But the direct is exactly that, just looking at that direct nutrient. Functional is a little bit trickier, and it's necessary because in functional medicine we often talk about there's a difference between being normal within a normal range versus optimal, and I think that's where functional assessments come in.
Yeah, absolutely. So I think one of the things to understand about functional assessment is it is looking at these biochemical pathways, and we're looking at what's going on inside the cell when we're doing a functional assessment, because there's all of these different biochemical processes occurring all the time. And to Patty's point, right, we can do a direct measurement for things like B12, but there's some evidence to show that maybe that is not necessarily telling us what is happening within the actual biochemistry, and that occasionally when people are actually within the normal reference range, it's floating around at normal levels in the serum, there's still some biochemical pathways that are struggling to utilize it a little bit. And so that's where something like a functional assessment comes in. And what we're looking at here on the screen is just an example of all these different metabolic pathways. And you can start to see, there's cofactors in some of these. Like here you see NAD and NADH, which relates to vitamin B3. And so it might be an indication if that pathway that is vitamin B3 dependent is sluggish or all jammed up, as we say, then that's going to be an indication that the patient might need more B3, even if their circulating B3 levels are normal. And there's also a kind of a side bit to this where, a lot of times we haven't established that the direct measurement of, say, serum B3, how effective that is at telling us the overall status of vitamin B3. So on something like our nutritional test, the NutriVal, the Metabolomics Plus, like Patty mentioned, we're combining direct measurements alongside these functional assessments. And oftentimes there's tens of biomarkers. For vitamin B12, there's like around 16 or 18 different biomarkers that relate to pathways that are B12 dependent, and that all kind of feeds into one big algorithm to spit out your overall need for vitamin B12. So that's the difference between a direct assessment and a functional assessment. But Patty's right, at the end of the day too, we're doing both an intracellular and extracellular assessment. So we're combining everything on our nutritional testing.
So the way in which I really like to explain functional medicine or functional assessment of nutrients to clients who might not be aware is I kind of like to go back to basic biochemistry, and I say what we're trying to do is we're trying to convert A into B, and moving A into B, you use an enzyme, and that enzyme has a whole host of cofactors it needs to operate. And so if you have an accumulation of A, like what we measure in our organic acid testing, then that means that you might not have the right cofactors to move it forward into B. And so having high amounts of A triggers us to realize that, oh, you might not have the good stuff. But also, you know, some things that we also need to consider when it comes to kind of functional testing organic acids is, you know, kind of what are other reasons your pathways might not be progressing forward? Is it just a lack of nutrient deficiencies? Or could it be genetics? Could it be a medication? Could it be heavy metals, for example? But I think that's just a really great way to kind of explain just the basics of functional medicine, how we test for nutrients and things like that. And so before we move on to the next slide, if you all can just touch upon, I'm sure you have reviewed plenty, I'm kind of putting you on the spot, but I'm sure you guys have reviewed plenty pre-test, post-test treatments, and I'm sure you guys have reviewed many tests where clients are like, but my patient's already on a supplement regimen. Why do they still have this need for nutrients? I think that's another really big question that comes about. How do you guys like to typically address those questions where they're either on a supplement regimen or this is the follow-up test to make sure the supplement regimen is going well, but yet they still have a need for certain nutrients?
Such a good question. Yeah, and I think, you know, one specific answer to that might be maybe they're not digesting and absorbing. You know, maybe there's a GI issue. Maybe they're not even getting that nutrient, or maybe it's not quite enough. But there's other influences too, day to day, Michael, right?
Yeah, and I was going to say, like, a classic example of this is like vitamin C, where on a nutritional test, somebody will be taking vitamin C and we'll see that they have still a borderline or a high need of vitamin C, and clinician patients like, well, I'm taking this, I don't understand. And it really comes back to that conversation about functional versus direct measurement and explaining, okay, we're not directly measuring vitamin C on the test. What we're measuring is signs of oxidative stress, right? We're measuring lipid peroxides, which is oxidative stress damage to lipids, and we're measuring 8-OH-DG, which is oxidative stress damage to DNA. Those things are still elevated, right? So the vitamin C that's on board might be helping. They may actually have been higher had the patient not been on vitamin C, but you know, that we're still seeing signs of oxidative stress. So we need to, as you were saying, get back to the root cause and evaluate what's triggering all this oxidative stress. You know, where's the free radical exposure coming from? Where's the toxic exposure coming from, and lowering those things? Because at the end of the day, vitamin C might help, but you've got to get to understanding what's triggering some of that root cause.
Yeah, and some of those things like toxic exposures can change day to day, right? So, and your diet can change. So it's important to make that connection for clinicians. They think just by taking this supplement, I'm going to be fine, but you do have to get to that root cause and really kind of work that out with them so that they understand. They can look at the test in that way.
The other thing too that I also consider is increased utilization. So there are some individuals who are in a state of increased utilization. So let's think about your athletes who are running marathons, who are your weekend warriors, riding their bike for like, 10, 15 miles on the weekends. Their demand for certain nutrients is going to be higher than somebody else. And even for women who are lactating, for us, there is a higher demand for various nutrients like amino acids and other things like that. And so you also have to be well aware of what is your patient's current demand for those nutrients. And it kind of brings me to a live that I did, I think about a week ago or so, and it talked about how do you cook your foods, because the way in which because a lot of patients are like, but I eat great, my nutrition panel should look excellent, but it's like, but you boil the crap out of everything, or you fry the bleep out of everything, so you also have to look at which way do you prepare your foods, and also in terms of supplements, which form of the supplement are you giving your patient? Are you giving your patient a one a day that's ultra compacted and they have low stomach acid, or they don't have the capabilities of breaking down that one a day, pill, or are you giving them in more of a powder form or more of a liquid form? These are all things to also consider as well.
Yeah, so, and if you're frying things with olive oil in high heats, then that's contributing to your lipid peroxides, and that's showing you why you need.
That's right. Mm-hmm.
And it might be contributing to your trans fats, because when you heat up olive oil to too high of a temperature and when it starts to smoke, it degrades possibly into even trans fats. So most definitely, absolutely. I really like the conversation that you just had about vitamin C. I think that's really a great kind of segue into this latter question that I want to ask you all. But I also think about vitamin C. You know, we talk about the oxidative stress markers like lipid peroxides and 8-OH-GG, but glutathione can also be another marker that can push the need for vitamin C, because vitamin C, along with selenium, milk thistle, alpha-lipoic acid, those are what are called recyclers to help move your glutathione into a state of more of a reduced state where your body can use it versus the oxidized state in which your body has already kind of used up all of its good juju. So, you know, that's something else that could also trigger the need for vitamin C. It just might be that your glutathione is either being used pretty quickly, which we'll look at pyroglutamate, or it can be a sign that you might not have enough glutathione, and we can just look at its direct measurement.
Yeah, and on the test result, right, we're measuring total glutathione levels. And so you get back to like biochemical root causes, like what is the reason why somebody might have lower glutathione? Could that be an amino acid deficiency? Could that be needs for vitamin B6 or magnesium, which are the cofactors to create? But you're right, at the end of the day, what we're saying is, hey, your glutathione is looking a little bit low. Your capacity to deal with free radicals and oxidative stress is reduced. Let's supplement, or let's provide in some, you know, whether it's food or a supplementation form, let's provide additional antioxidant support to mitigate the fact that you have low glutathione levels.
Yeah, and just review those amino acids real quick for everybody.
So we've got glutamic acid.
Yep, cysteine and glycine. And then B6 and zinc also help as well.